All right, so this video is just going to continue on the first session. So it's just going to cover the two pieces of paper that we really need to fill out with every client. The first one being the informed consent, and the second one being the medical history questionnaire. All right. So the informed consent is really just going to cover the purpose and explanation of tests, the risks that are involved, the benefits to be expected and available alternatives to exercise testing procedure, confidentiality and use of information, and inquiries and freedom of consent. All right, so we do perform some tests, bod pods, submaximal VO2, blood pressure. There are some risk involved with them, so we just need to make sure that they understand that. We also want to make sure that they know that their information is confidential. So as a trainer and as a member of Get Fit, Stay Fit, it is very important that you understand that the information that you collect about your client is not something to be shared publicly, okay? That's everything from their test results to the program. All that information is confidential, all right? And then lastly, just consent that to the rendition of all services and procedures as explained herein by all program personnel. Okay, so allowing us to perform the personal training. Okay, so the informed consent must be signed before the first session, all right? And the medical history questionnaire should be filled out, all right? You probably know the medical history questionnaire. It's been filled or explained to you in probably other classes. Another one is the physical activity readiness questionnaire. We've opted to go with the medical history questionnaire just because it's a lot more detailed. It does take a little bit more time to fill out, but it gives you the opportunity to really have more of a conversation about the individual's past and current conditions. So use this as part of like conversation starter, and also just to make sure that you understand everything that the client has going on, okay? Especially like medication, we need to really understand what it is, how it affects the body, and what that means for our exercise programming, okay? So both these pieces of paper must be filled out before the first session, or during the first session. Where you find these pieces of paper, they are always going to be in my desk in the front left drawer. I have two blue folders very clearly marked: medical history questionnaire and informed consent. They are in there. I try to keep them filled with multiple forms. If you notice that we are running out of forms, then just shoot me a message, or if you see me, just let me know. That way I can make more copies of these forms, all right? That way nobody's ever trying to get there and form signed and it's not available and they have to chase me and blah, blah, blah. All right, so let's make sure that we get these papers signed, all right? Another quick thing is that when you are filling out these pieces of paper, this is also a good time to go through some other pre-screening questions. That includes, you know, what have they done in their past for physical activity, what are they currently doing, and then what are their goals going forward, okay? So more questions that really let you understand who they are, what they've done, and where they want to go. And that's all information that you are, once again, going to use towards your program design, all right? So that's all for this video. Great, thank you.